What about cannabis? I did an episode of this podcast about cannabis, and I did highlight some of the medical applications of cannabis. I also highlighted that very high THC may predispose, especially young males, to later psychotic episodes. There's more and more data coming out about that all the time. I've got a lot of flack for saying that, but that's my take on the data. I think a lot of people use cannabis to manage their anxiety and as an alternative to alcohol. What is the relationship between cannabis and testosterone and sperm production, or I should say sperm quality?
Yeah, so this is also a very common question. Again, with this wave of legalization across the country, I think more and more men and women are exposed to it. Again, there's data that the more men are exposed to it, it can lead to some harm in terms of sperm morphology and sperm numbers as well. One of the sort of landmark studies was about 1,200 men, and it found that men that used cannabis daily had significantly lower concentration, motility, morphology compared to those that didn't use it. So I think that generally how men are counseled, but there's also other data that shows really a null effect, and I think that it goes into probably the composition, how men are taking it, the frequency, because a lot of that data is not well teased out in a lot of these studies.